Skin cancer is the most common form of cancer in the United States. Screenings are part of the American Academy of Dermatology's national campaign to promote skin cancer prevention, early detection, and treatment options. Gundersen Lutheran is offering a free skin cancer screening as well. And joining us this morning from Gundersen is dermatologist Dr. Kurt Mueller. Good morning, Dr. Mueller. Thanks for getting up with us.
Good morning.
I noticed right away we spent a lot of time outside this weekend, and I noticed cheeks getting red and thought, oh my goodness, it is sunscreen time.
It is sunscreen time, but really we preach use even during the winter months and even on cloudy days. So it's a good time to use it, but establish habits for the whole year.
Okay. Skin cancer, the most common form of cancer in the United States. We hear so often about the importance of sunscreen. Are people just still not getting the message, or is it folks that maybe are getting the message but too late?
Well, it is to some extent getting the message too late. Most of us get the vast majority of our lifetime sun exposure in our younger years. So really, it's most important to protect children and younger people. But at the same time, it's never too late, because some of our older individuals that get an increased number of skin cancers will at least get fewer of them and less aggressive if they're protecting from the sun.
What are some of the signs to look for that something might not quite be right with your skin?
A sore that won't heal, something changing color, changing shape, size. What I really tell folks is to look their entire skin surface over about once a month, and anything new or changing, no matter what it looks like, should be looked at. Really, I tell patients to trust their gut. If something doesn't seem quite right, it probably isn't.
Are there certain parts of the body that folks often miss?
Well, most people tend to think that it only occurs on their face or maybe on their back, places where they've had a sunburn at some time. But in fact, any part of the body can be affected by skin cancer, even if it's never been exposed to the sun. So when I tell people to check their own skin, I suggest head to toe, even the bra, bikini areas, even the feet, places people don't ordinarily think about.
Wow, the feet. I guess that'd be one body part that I would probably not even, notice. Well, you are holding a screening, so why don't you tell us more about that?
Well, it's this coming Saturday, and we're going to just do complete skin exams on patients. They can start calling, I believe, on Wednesday to make appointments for that. And what we really hope is to be able to get in people who perhaps don't have access to health care or don't have insurance, who have questions about things and are wondering whether they should spend their hard-earned dollars to get something looked at. So my hope is that this can be a benefit to people, and hopefully we'll be able to see a lot of people and tell them things are fine and put minds at ease. And if there is anything, we hope to catch it early and improve their health.
What's the cure rate like for skin cancer? Is this a cancer that you can go on and live many more years after your diagnosis?
It's very curable if it's caught early. That's really the key. And we're really trying to get people, if you suspect anything, come right away. In many forms of skin cancer, the most deadly is melanoma. That's the one we really worry about. Luckily, that's the rarest, but the most dangerous. Many skin cancers can easily be treated, and with melanoma, if it's caught early, it's very effectively treated.
Okay.
So many patients can expect a very long lifetime after their cancer is detected if they come in early.
Well, that's another reason to go ahead and come in and see you this weekend. So again, you are accepting reservations, so to speak, during this week. And I know that this clinic, it's very, very busy, so you're encouraging folks to call ahead and reserve their spot?
Yeah, people probably will need to call on Wednesday. It usually fills fairly quickly.
Okay. Well, Dr. Mueller, thanks so much for getting up with us. Wear your sunscreen year-round. Thanks for that advice.
Thank you very much.